One thing I've found is that stroke survivors are very hardworking and dedicated to getting better.
Welcome to the Strokecast. A Generation X stroke survivor explores rehab, recovery, the frontiers of neuroscience, and how to peel a banana with one hand.
Hello, I'm Bill Monroe, and welcome to episode 139 of the Strokecast. Today's episode is sponsored by the fine folks at Modus Nova. To find out if Modus Nova can help you recover the use of an affected limb after stroke, visit strokecast.com/Modus Nova. And by the fine folks at Like Minded. To find out if the Like Minded membership program is right for you and your recovery, visit strokecast.com/like-minded. Last week in episode 138, we talked about the nature of post-stroke depression. This week, we talk about one tool that may help treat depression. Dr. Ruth Taylor-Piliae has been working with stroke survivors who use Tai Chi as a form of therapy. In a recent study, she's actually demonstrated that Tai Chi reduces post-stroke depression. So, can Tai Chi help in your recovery? Maybe. If your doctor says you can do it safely, go ahead and give it a shot. This week, I talk with Ruth about the intersection of Tai Chi, stroke, and depression. So now, let's meet Dr. Ruth Taylor-Piliae. So Ruth, thank you so much for joining us on Strokecast this week.
You're welcome. My pleasure.
So what I wanted to talk with you about is going to be some of your research and some of the work around depression after stroke. And we just had a good conversation about depression last week and some of the research around that. How do you identify depression in a stroke survivor?
Depression in a stroke survivor, it's identified kind of with different tests or questionnaires that you can kind of screen somebody quickly. So perhaps someone is going to their doctor's appointment and there are several screening questionnaires that they can administer to see whether they need to investigate that further. The most common one probably is the patient health questionnaire. It's 9 items long, and based on answers to that, someone who, like a physician or a nurse or someone who is familiar with these kinds of tests would be able to determine whether someone needed further evaluation for depression after someone has a stroke.
And that's some of the stuff that ends up on, I guess, that Checkin questionnaire I get every time I go to my physiatrist to get my latest round of Botox. You know, they're starting to ask about depression and about how you're feeling on that initial confirm your name and address type of paperwork.
Yeah, I wouldn't know what all medical practices are using, but it's definitely a recommendation from the American Heart Association, American Stroke Association, that people or that stroke survivors, when they go in for their medical checkups or follow-up appointments, that they're screened for any symptoms of depression after their stroke.
How might a caregiver or a partner of a survivor spot it to perhaps suggest to the medical team or the survivor themselves that they should probably ask about this? Or how might a survivor maybe spot it and say, oh, hey, maybe that's what's going on with me?
There's a couple of things like feeling down, feeling lethargic, no longer motivated to do anything. Some of those kinds of things are classic symptoms that might indicate that someone is heading in that direction. Not wanting to get out of bed, those kinds of things, right?
Sure. And that becomes then one of those things too, is whereas you look at that, you've got to also then sort of tease apart how much of that is related to depression versus how much of that is related to the neurofatigue or just the disabilities and change in life that comes from surviving a stroke. And I suppose that's what the expertise of the medical professionals is for.
Absolutely. Yeah.
So how would you say that post-stroke depression differs from depression in someone who hasn't had a stroke?
Either condition, you're going to assess somebody and screen for symptoms in the same way. You're going to treat them in the same way. So there's really not a difference in terms of how somebody who has depression after a stroke or somebody who never had a stroke and has depression, how they're going to be treated. So normally people are treated with either pharmacotherapy, which is like antidepressant medication, or maybe psychotherapy, something like cognitive behavioral therapy, right? With someone who has a stroke, about 1 to 2/3 of stroke survivors do tend to get some sort of depression after or depressive symptoms after the stroke. And so that's why it's something to really look for in a stroke survivor. It affects their treatment efficiency, it affects their outcomes after a stroke, and things like that.
Yeah, when we're talking about it affecting someone's treatment efficiency, what we're talking about there too then is, I mean, the key to recovery is you got to do the work. You got to get out, you got to do your exercises, you got to do your therapy. And if you're lacking that motivation, you're not going to do that. And whether that's due to whatever reason or whether that's due to depression, that's going to negatively impact your outcome.
Yes, exactly. Mm-hmm.
So regardless of how you get to depression, a lot of the traditional treatments are then the same.
Yes.
Your research has been working on addressing depression after stroke in a different way with Tai Chi. So let's start there then. So what is Tai Chi?
Tai Chi is it's a mind-body exercise. You use your mind, your body, and your breath. It's been practiced in China for over 1,000 years. It's low impact, moderate intensity. It's considered often a meditation in motion, and that's due to the slow and relaxed and graceful movements. And these movements are done in a mindful manner that flow together in a choreographed sequence of movements. It's quite popular, and you can find Tai Chi classes pretty much in every community, at least in urban, larger communities. And it's a relatively low-cost exercise. It can be done inside, like, for example, at a YMCA or a senior center, or it can also be done outside, the weather allows, in a park. So it's quite a portable form of exercise.
Requires very little gear.
There is no gear required at all, other than make sure you have comfortable shoes on.
I mean, one of the things that it sounds like then with these carefully controlled motions and patterns, in some respects, it sounds like a less clinical version of the PNF patterns that a PT or an OT might take someone through. PNF patterns are it's a series of motions that are common in physical therapy or occupational therapy to actually take a joint through its range of motion. So, for example, an occupational therapist might help you move the arm in such a position that to simulate putting on a seatbelt. With that, raise your arm off, pull it down across your chest to your hip and then back, or simulating drawing a sword, or making snow angels, or doing some of those particular types of things.
Right. It would be something that would be complementary to that for sure. Mm-hmm.
So what made you decide to look at Tai Chi and figure, well, this could be good with stroke survivors and specifically around depression? I mean, were you trying to relieve depression with Tai Chi? How did this come about?
Sort of my interest in using Tai Chi for stroke survivors came about when I was doing a postdoctoral fellowship at Stanford University and was asked to write a manuscript for a journal looking at perhaps the potential benefits of Tai Chi for stroke recovery. And, some of the most common symptoms or problems or concerns that stroke survivors have is balance issues as well as depression issues after the stroke. And so some of my earlier research looked at using Tai Chi and really looking at balance, lower body strength, gait and fall prevention. But then always when I did those studies, depression symptoms would come up in about 1 to 2/3 of the stroke survivors I enrolled, even though I wasn't specifically targeting stroke survivors with depression. So I then got some funding to conduct a small study looking to see whether we could look at whether Tai Chi exercise could be used alongside conventional care, things like your antidepressant medications as well as your psychotherapy, to see whether it would help reduce symptoms of depression. We also looked at anxiety and stress. And so we specifically targeted people with post-stroke depression symptoms. And, we wanted to see whether we could even do this, whether, number one, could we even recruit these folks to enroll in a study? And then just kind of, looking at how we could measure it. One of the challenges is with post-stroke depression that often symptoms persist even though they are having this conventional care, antidepressant medication or psychotherapy. They still might be having symptoms of depression, and it could be due to a number of factors, perhaps ineffective treatment, maybe, it's not working, maybe they're not willing to take the medication. So it's important to have other options for people to do something that can make them feel better and help in their recovery.
There could be so many other factors, setting aside the brain damage itself as a thing. One of the things that I do like about this approach, especially, is whenever I look at alternatives to what's considered the most traditional medicine and what's out there, and when people start looking at that, because there is a lot of just snake oil and a lot of people just trying to rip us off out there. And so what I tell people is look for something that is, first of all, is there a risk of danger? If there is, stay away. Something like this, no risk of danger. Aside from the falls that are a part of everyday life, and with proper care and proper caution, that's easy to alleviate. Beyond that, it's okay, is this going to require excessive time or money that's going to take away from traditional therapy? And again, we get into something like this, and nope, it's not going to. So regardless of so then it becomes something like, regardless of whether it's research has shown it to be effective, there's probably not a whole reason not to do this. But in your case, we do have some preliminary research around effectiveness. So what was it that your research found?
After the intervention, we had participants do the Wu style of Tai Chi. They did a short form, 24 postures. And after just 8 weeks of this Tai Chi, we had some significant changes with less symptoms of depression, less anxiety, and less stress reported. We also found that participants had better sleep efficiency and less wakefulness after sleeping. Like oftentimes people wake up during the night, and they had less of that after the intervention.
I think that's an important thing. We're seeing definitely positive results. We're seeing something in the study that it works. But as you said, this is a feasibility study. Mm-hmm. There were 11 people in it. So, mm-hmm. I mean, obviously it's going to be tough to draw much more detailed conclusions beyond that. Mm-hmm. But did you see any differences in younger versus older survivors?
Well, in this study, the average age of the participants was 70 years old. And, we didn't do any sort of subgroup analysis looking at younger versus older, or even looking at men versus women. When you have a sample size that's small, you need to be careful that you Number one, you don't have the power. We weren't even powered to look for differences. They just came up. But I think the real concern with having a small group like this is if you start to do those subgroup analyses, you could start to reveal people's identities, which you don't want to do.
Sure.
Right? Yeah.
Sure.
Yeah.
And it's one thing to try to extrapolate from, a large group of women versus a large group of men,
Exactly.
as opposed to, hey, here's what Linda got.
Yeah, exactly. And we don't want to do that. So we didn't do any of that.
So I think what's really important from a study like this then is that it shows that, hey, there could be something here. Yeah. We need to take a much deeper look at this and sort of expand the research and maybe do another study that's going to look at a larger group and maybe is going to look at some more questions.
Exactly. Yeah. And in this study, we also were challenged a little bit with COVID-19. We had planned to do 12 weeks intervention, and we had to cut this one short to 8 weeks because of restrictions due to COVID.
Right. This is a very much traditionally very much in-person group activity.
Yes. And you want to do that in person for safety, right?
Right. Somebody needs to be able to help with helping people not fall, and if somebody does, be able to take advantage of that. And that's a lot harder to do over a video conference.
For sure. We protect them, in my studies, all the Tai Chi studies I've done, I've never had anybody fall during a class. We're very mindful of that and make sure we put steps in place so that people are safe. There are chairs always set up in case anybody wants to sit down and rest for a minute. And there's usually plenty of research staff there to kind of monitor what's going on, because the Tai Chi teacher cannot always see every student. So it's good to have another set of eyes there in the class to make sure they're safe. And also you want to make sure people are, particularly with their feet, you want to make sure they're stepping correctly, because you don't want them to get a different sort of injury, like, if improper foot placement is critical to avoid, because you don't want somebody to develop a knee injury.
And when you're dealing with folks who are already dealing with things like foot drop or maybe wearing an AFO or weaker knee control, greater risk of hyperextension, and all these other things, those are things that your staff, your team especially, needs to be aware of.
Oh, absolutely. Yeah.
Now, are most of these Tai Chi instructors that are participating in this program, are they specifically, are they coming more from a Tai Chi background, or are they physical or occupational therapists or other medical professionals who have additional training in Tai Chi? So how is that difference manifested?
In one of the first studies I did here in Arizona, the teacher, and that was with stroke survivors, the teacher was a pure Tai Chi teacher with extensive experience working with older adults, including those with chronic health conditions. In this feasibility study where we looked at stroke survivors that have post-stroke symptoms of depression, the Tai Chi teacher has also extensive background in teaching Tai Chi, including older adults with chronic illness, but is also a registered nurse.
So have you found in your broader experience that the type of stroke somebody's had, whether it's hemorrhagic or ischemic, or whether it's more brainstem or other parts of the cortex, has that made a difference in the way people respond to Tai Chi?
I haven't found that. We've seen in our research that all stroke survivors, regardless of stroke type, have benefited. My own personal observation is that the ones who have hemorrhagic stroke seem to have more physical disabilities, but not necessarily. But it doesn't mean that it's too much, that they can't participate. Regardless of how much physical disability somebody has, after a stroke, they can still benefit from participating in Tai Chi, because Tai Chi can be adapted to a person's prior exercise experience as well as their current physical ability.
And that's an important thing. And I think we've encountered that in other types of exercise-based therapies as well, with adaptive yoga. And there's a woman in the Seattle area, she's been on the show way back in the early days, Gabriella, who runs a tango program for stroke survivors and other folks with neuro conditions that sort of adapts that to get some benefits. Mm-hmm. Is there something unique, though, about Tai Chi that makes a difference in alleviating depression? Or could we expect to see similar results from then other movement therapies like tango or yoga or even just other exercise programs? Is there something about Tai Chi that uniquely drives this difference?
I don't know if there's been enough research that's looked at, like, say, comparing Tai Chi, yoga, and some other mind-body interventions. My personal perception is that all of these mind-body types of exercise, so that would be Tai Chi, yoga, Qigong, maybe some dance movement, would be beneficial, because they sort of have this holistic approach to movement. So you're using sort of your body to do the movements. You're making sure that you have relaxed breathing. And then you're also being mindful and being present in what you're currently doing. And if those features are present, I would think that they would have similar benefits in terms of reducing post-stroke depression.
So at the very least, get out and start doing it, and start doing it in a very deliberate way, whatever it is, with that focus as we continue to do deeper research into understanding the why.
The great thing is that, if somebody prefers one modality over the other, they could choose it and still be able to gain benefits, right? So with like Tai Chi, if you think about it from a holistic well-being kind of perspective, if you look at somebody's physical well-being, we know that body posture can affect mood. And so with Tai Chi, people learn how to have correct body posture, which leads to perhaps better, less depressive symptoms. Also, if you're looking at the mental and emotional aspect of well-being, with Tai Chi, you need to have a mental focus. And then this helps to regulate negative emotions. If you look at social aspect, within Tai Chi, because it is taught in a group-based exercise class, there's that social support that develops. And I've seen this over and over again. This creates a sense of belonging, which also contributes to less symptoms of depression. And then there's also the sort of spiritual well-being, where it might help somebody with their self-awareness or discovery, which would then lead to less symptoms of depression.
So again, it's all of those key things that we struggle with depression that can be focused on this, the socialization, the idea of just getting up and getting out and just doing a thing. It is something that we really want to treat people with depression with, help them develop the motivation to go out and do that.
Right. And this Tai Chi could be done, like, say, a stroke survivor and their caregiver. They could both participate in a class. That would be optimal, so that, they could even maybe perhaps take one thing home from the class and practice it before the next class, right?
Right. Mm-hmm. So you mentioned that you're using Wu style. What is that, and how does that, say, compare to other styles of Tai Chi?
Mm-hmm. So there are 5 main styles of Tai Chi. There's the Chen, the Yang, the Wu Hao, and the Sun style, right? And all styles of Tai Chi follow the same principles, which is, keeping your body straight and extended, having relaxed breathing, rotating from your hips. So they're all beneficial. In Tai Chi, it's thought that all Tai Chi originated from the Chen style, and the Yang Wu, Wu Hao, and Sun styles were derived from that. But they do all follow the same principles. Shifting your weight between your legs, turning from your hips, keeping your knees slightly bent, keeping your head and trunk upright, being relaxed, having beautiful ladies' hands.
So why did you choose the Wu style then?
Well, because I chose in this case, it was the style of Tai Chi that the Tai Chi instructor practices.
Well, there you go.
Yes. And she is a great Tai Chi instructor. This was, she has, probably over 25 years of teaching experience, and has been doing Tai Chi for even longer, and is also a registered nurse. So it was an opportunity for us to collaborate on this project together.
That's fantastic. And does then the exercises you've been doing with the stroke survivors, is that very, very traditional in the Wu style, or has it been modified in general for this survivor group?
It's the same movements that are in Wu style. And, with anybody who's learning Tai Chi, there are short forms and long forms. And normally when you have a beginner with Tai Chi, you start learning some of the short forms first. You don't go out and expect somebody to learn over 100 movements, right? So
right.
In this,
I would have been challenged to do that before stroke.
Yeah, exactly. I know, seriously. So for this one, they were learning 24 different movements, and that was going to be over 12 weeks. So that's about 2 new movements a week. And then with each class, it's sort of you repeat what you've learned up until that point before you learn anything new. But the classes met 3 times a week, so there was plenty opportunity to learn 2 movements and repeat what they'd already learned. So that's about normal. Most of my Tai Chi, actually all the Tai Chi studies I've done with stroke survivors have been like 3 times a week for 12 weeks, and there's been 24 postures that have been learned. So 2 movements a week.
And when you were talking about meeting 3 times a week, that's already a pretty intense outpatient therapy schedule.
Yes. And you know what? One thing I've found is that stroke survivors are very hardworking and dedicated to getting better, and they're used to going 3 times a week for their physical therapy, occupational therapy, speech therapy, maybe all of the above or just some of them. And so coming to class was normal for them. And it was better to offer 3 times a week because, say, for example, one of the days they couldn't come because of a doctor's appointment, they could still have 2 other days they could come. But if you only offered it 2 times a week and they could only come to 1, then, you're really limiting sort of we call it the dose effect, or the amount of Tai Chi that somebody gets. If they don't get enough of the Tai Chi, they're not going to see any of the benefits.
Like with anything else, it's the thousands of repetitions you ultimately need to do as part of recovery. The more times you can get in there, the much better it's going to be. Yeah. So one of the things you mentioned as a benefit is that the way it helps with the spiritual aspect of your well-being. And I know we've seen in some of, especially in the US, the religious right communities objecting to yoga as a spiritual or a religious or an anti-Christian type of thing. And I know that's not certainly a mainstream view, but it is one we've been hearing. How have you had any folks who've had that same concern around Tai Chi, or how does the spiritual aspect of Tai Chi then play into people's lives and recovery?
Well, it's not something that, as far as I know, that many people have really researched that much, but it's out there as a potential. And I think of it more as sort of the self-awareness and discovery that somebody has. It's not a religion, right? So it's just kind of at that higher level of well-being where, yeah, it's not something tangible that you can really measure.
Fair enough. And betraying some of my ignorance here and some of my limited knowledge, I understand that Tai Chi in China has also gotten caught up in the Falun Gong movement and the response of the Chinese government to that community. Have you seen any of that sort of stuff impacting the acceptance of Tai Chi?
No, I haven't. Not at all. I would say, stroke survivors here in the U.S. are quite open and responsive and, really embrace Tai Chi as a form of exercise and usually are pretty excited to be learning it. It's very empowering for them.
That's great. That's great. The other thing I did want to ask about is I suppose we've been talking a little bit on some of the dialogue we hear from the far right here in the U.S., but on the other side we hear more about questions regarding cultural appropriation, where a tradition or an aspect of what in the United States is a marginalized culture is then taken and used in different ways by the dominant American culture. And how have you heard concerns about cultural appropriation when it comes to taking this traditional Chinese technique and then incorporating it into a sort of Western medical practice to treat depression? Is this something that's come up before, and what have you generally seen the conversation around that?
No, I really haven't heard or seen that.
Okay.
No. Mm-mm.
Well, great.
Yeah, no, I really haven't. But one of the first study I did here in the U.S. That was back when I was doing my PhD. I particularly focused on ethnic Chinese using Tai Chi exercise, and those were ethnic Chinese with risk factors for heart disease and stroke. And I selected them first because I thought, well, we first need to see whether this, because I wanted it was a culturally relevant and appropriate form of exercise. And if they would stick with it and do it, and we could see benefits, then I thought that was the opportunity then to extend it beyond that group of people.
And that makes a lot of sense as a starting point. I mean, one of the key things about any therapeutic exercise that's going to be a successful intervention is the more relevant you can make it to a survivor's life, the much more likely they are to engage in it and to get some benefit from it, and even to tap into existing neural connections already around that activity.
Yep. And interesting thing, when I was doing my PhD dissertation research, I had complaints from the non-Chinese that they wanted to be in this study. So I knew that we were on to something unique that we could bring to people that had like heart disease and stroke. This is just sort of a starting point, really. This last study, the feasibility study that we did, it particularly, we only enrolled people that had symptoms of depression. We would really like to receive some funding to do a larger study, and so that we could make more recommendations and maybe some, benefits to help with recovery for stroke survivors so they can improve their quality of life.
So this is then definitely, we'd love to hear from more research funding opportunities, and for other folks who are interested in pursuing this kind of research to understand more about the potential benefits, and perhaps work on conducting their own studies.
Right. And if anybody's interested in contacting me to collaborate on some future studies using Tai Chi for stroke survivors, I'd be happy to do that.
Fantastic. And we'll be happy to have those links over in the show notes at strokecast.com. Mm-hmm. So as we look into this, folks who may think that, maybe after my stroke, maybe I am living with depression, maybe I'm not, mm-hmm. but I think Tai Chi does sound really interesting. What should they look for if they wanted to go find their own Tai Chi program or instructor?
If you're looking for a class, you want to find a Tai Chi teacher who has worked with people, with maybe a chronic health condition, older adults. You might want to observe a class first before you commit to like a series of classes. You may need to check with your healthcare provider to make sure it's safe for you to participate. And I would recommend, as a beginner, to first learn Tai Chi with in-person instruction, because you want to make sure that you have correct foot placement. You don't want to develop any sort of knee injury from having your feet incorrectly placed, and that kind of thing. Some of the locations you could look for classes would be like a YMCA, a senior center, community center, maybe even churches have them. And you mentioned a hospital might have them. So you can kind of look in your community and see who has them. The area agencies on aging often know about Tai Chi classes and where they are. That would be another resource to look for those. And you want to have a discussion with probably the instructor to make sure that, that's going to work for you.
Ruth, this has been fantastic. If folks want to know more about you and what you're up to, where should they go?
Oh, so you can look for me at the University of Arizona in the College of Nursing. And I do have a faculty webpage, so I'm very easy to find. Nobody else has this last name, Taylor-Piliae. You could probably even just Google it and contact me, and it'll come right up. I'm the only one, I believe, in the world that has this last name. So if you could spell it, you could probably find me.
And that is a huge advantage. And I'll have those links, of course, over in the show notes over at strokecast.com. And that brings us to our hack of the week. But first, I want to talk about sponsor Modus Nova. I've been using the Modus Hand to help with, my hand recovery. The Modus Hand is an air-powered, AI-controlled robotic exoskeleton that I wear while playing video games. As I work to move my biological hand, the Modus Hand helps me or it resists me so I can get the most out of this workout. It's helping me to get the thousands of repetitions that I need to get that hand back. And the reports that it gives me tell me just how well I'm doing. To learn if Modus Nova can help you recover use of a stroke-affected hand or foot, visit strokecast.com/Modus Nova. Use promo code STROKECAST for 10% off your first month. This week's hack comes from Lainey Ishbia of Trendable.com. I spoke with Lainey back in episode 136 at strokecast.com/trends.
You don't have to buy these expensive grippers or get grippers. You can take elastic bands and put them on perfume bottles, on cologne, on makeup brushes, on anything that you have difficulty gripping. And the elastic, the rubber band acts as a gripper. You can put them on shampoo bottles, anything.
Now let's take a moment to talk about sponsor Like Minded. Community is a powerful thing. People in the stroke field, both professionals and survivors, can share powerful perspectives with survivors and remind us that we aren't alone. I mean, that's one of the reasons I even started this show, was to help get people talking and break through some of those silos and share stories with one another. Because we don't have to go through this experience by ourselves. Like-Minded is a nonprofit organization started by occupational therapist Jane Connolly. Members join online classes and support groups led by therapists and survivors. They can access replays of these sessions, participate in private text messaging groups, and members even get free membership to NeuroFit VR, a virtual reality interface to help with recovering cognitive skills after brain injury. Get the support, accountability, and direction you crave and deserve for just $45 a month. To learn if Like-Minded is right for you, visit strokecast.com/likeminded. Use promo code STROKECAST for 20% off your first month. Ruth's work with Tai Chi is, well, it's certainly interesting, and as we discussed, this is a small study. It's a great starting point, though, and it's a starting point from which we can learn more and open up the possibility of future studies. I mean, let's take a look at it, though. I mean, if you think about some of the different things you get with Tai Chi, it makes sense that it would be good for recovery. Tai Chi practitioners end up practicing balance, they practice deliberate movement, they practice focus, they're engaging in physical exercise, and depending on where they're taking their Tai Chi, they may be engaging in a social activity, and they're practicing learning and repeating patterns. And on top of that, it's almost meditative for many folks. As Ruth said, it's sort of meditation in motion. And you know what? A lot of the individual things are things that doctors and therapists generally recommend for stroke survivors. Tai Chi is one of those things where, if it's done carefully, it's safe, it's low cost, and it can supplement traditional therapy. As far as I can tell, there seems like there is a possible upside here, and there are no significant downsides. So if you're interested and your doctor is on board, go for it. Now, I'm wrapping up this episode as the Tokyo Olympics closing ceremonies are playing on my TV in the background. There were amazing performances over the past couple of weeks amid the controversy of whether the games should even have gone ahead, with so many people throughout the United States and throughout the rest of the world and Japan contracting, suffering, and dying from COVID-19. I mean, I still don't know if it was right to go forward with the games, but I can sort of see both perspectives on that. But they have gone forward, and so here we are. And now the games are half over. You may be thinking there for a moment, wait a minute, Bill, but didn't you just say this was the closing ceremony? What do you mean half over? Well, the games have wrapped up for the mostly abled Olympians, but they're just about to start for the Paralympians, folks playing their sports with their disabilities. Folks who may have qualified based on the combination of their athletic skills and their disabilities, whether those disabilities were caused by stroke, accident, trauma, chronic illness, early developmental issues, or any number of other causes. Modern streaming, communications, and social media are going to make it easier than ever to follow the stories and accomplishments of these athletes and maybe be inspired by their efforts to pursue our own athletic or creative endeavors. The Paralympic Games in Tokyo are going to run from August 24th through September 5th. The U.S. alone is sending more than 200 athletes. So be sure to check out some of the games if you get the chance and follow the athletes on social media if they resonate with you. To learn more about Ruth's work with Tai Chi, be sure to check out the show notes over at strokecast.com/Tai Chi. Tai Chi is spelled TAICHI. So that's at strokecast.com/Tai Chi. You'll find all of her links there, including a link to the study. Be sure to share this episode with a friend or therapist in your life by giving them the link strokecast.com/Tai Chi. Be sure to subscribe to the Strokecast newsletter over at strokecast.com/news for the latest from recent episodes and previous guests. And of course, as always, don't get best, get better. Thanks a lot. I'm Bill Monroe, and I'll talk to you soon.
The Strokecast, Bill Monroe, and Bill's guests provide general information and entertainment, not medical advice. Please do not make any changes to your treatment plan or the execution of your treatment plan without first consulting your personal doctor or medical team. The Strokecast is a proud production of the Currently Speaking Podcast Network.